The patient was admitted to the hospital yesterday with a chief complaint of shortness of breath and productive cough for several days, period. His COVID-19 test was positive, period. One of the things that I find very interesting about the virus, and surprising, I guess, it's how it can affect some patients very differently. So you're okay with the medication?
I'm okay with it.
Okay, so I think they already started the process. Again, it's 5 days, it's intravenous, so you have to stay. You know, I think it speaks to something we don't know about this virus. We see that with other infections, which some patients seem to be more susceptible based on some genetic factors or some receptors of the target cells or the target tissues for the virus. So that is still a very, very unexplained reason why, you would expect to see some people that don't do well because of the infection, but then you still see people that presumably healthy and young that can, die or have a really bad consequence from being infected from the virus. And there's something we don't understand yet about this that, hopefully will come up. One of the things that moved me to be an infectious diseases physician was this kind of challenge with the unknown, viruses or bacteria, or in a way it's a challenge that, that is, I welcome that sometimes with some of the infections and the new bugs that come up.
Dr. Perez.
No, nothing new. I guess I can say we had our infection control meeting that was not just about COVID yesterday, so it was kind of good to talk about non-COVID things in the meeting. We still need to attend to those, obviously. So, I think the hospital has had a good vision of realizing this was, a challenge. This could be a significant threat for the community, for the hospital resources, and we started preparing for that, in advance. Correct. Like somebody that is positive, you want to know who has that person exposed, and you want to test all those people. ¿Cómo le va?
Bien.
Es algo en chino, no sé qué es. De nada, que vaya bien. Hasta luego. Good morning.
Hey, bud.
Good morning. Good morning. I've seen a lot of support from the community and realization of, the work that some people do in the hospital or outside the hospital that is so important to keep the community safe. So everyone is rallying around to kind of be able to fight this disease and this infection.